Hey everybody, I wanted to do a quick video on what you can do for spinal stenosis to follow up my previous video on what it is. Just a real quick review. Spinal stenosis is when these little spaces where these nerves come out get smaller. So extension makes it smaller, flexion makes it bigger. Patients with lumbar spinal stenosis cannot walk long distances. They cannot stand a long period of time. They do much better in a sitting position. They feel much better if they're leaning forward like this on a shopping cart at Walmart. So if you have those symptoms, we evaluate you, we confirm that you actually have spinal stenosis, and this is what we do for patients that have spinal stenosis. We want to try to open up the spaces in the lumbar spine, and the one thing I want to see on the eval is, can the patient even elongate or lengthen out that lumbar spine? So I'll test their forward flexion, and this is what normal forward flexion looks like in the spine. It's a big rainbow curve of my spine. I can feel a stretch all the way through there. That's maximum flexion through my lumbar spine. A lot of patients just can't do that. They're so stiff. So we do a lot of soft tissue work, a lot of hands-on work to make that more flexible tissue. And then we follow it up with an exercise program. Here are my favorite exercises to get the lumbar spine a little bit more mobile, open it up, and free up some range of motion to take some of the pressure off of that back. Number one is just a quick lumbar spine stretch and flexion from the bottom up. We're gonna bring one knee towards your chest, and I'm just looking at the camera, but I would love you to relax your head a little bit during this exercise. I like both knees in a bent position in the start because I'm actually trying to round my back during this exercise, so it makes no sense for me to put that one down there. That's gonna limit the overall amount of flexion I could get through the spine. So I'm gonna bring this knee up to my chest, and you can see when I run out of hip motion right there, you can see my lumbar spine rocks back, and I can feel more pressure down through my spine on the table when I get it into flexion versus here where I have this little bit of curve. Here, all of that curve is gone, and I could feel a nice relaxing stretch. The one thing you want to watch out for here is any hip pain in the front of your hip. That just means your hip is aggravated, and we don't want to aggravate someone's hip while we're trying to get their back to feel better. So if you have anterior hip or groin pain when you're doing this exercise, no go. Don't do this exercise. If it feels good and opens up your spine and takes that pain away from your back, awesome. Great time to do this is after a hot shower because you're already full of some peripheral blood in that area and you're looser, you'll get a better stretch. So that is an awesome time to do this. Single knee to chest, I love 10 times for 10 seconds, and then I'll go over here and do 10 times for 10 seconds. That's called single knee to chest. A more aggressive version of that, and one that I don't do with sensitive backs, is a double knee to chest. So I could bring my knees up to my chest and really get that end range flexion, and I could feel that stretch out my paraspinals and all the joints of my lumbar spine. I don't do this with super sensitive backs because watch this. I have to lower down in between, and that is a stability demand. And on a back that's super sensitive, that might feel great, and then, ooh, that might feel aggravating to the person. So for the really aggravated back, I might only do single knee to chest because double knee to chest has those 2 feet off the ground. For most patients, will do it that way no matter what you say. So I'm going to avoid that exercise if you're super sensitive and just do the single. If you're not super sensitive, you can do the double. That's 2 great exercises that I love. Another one just to mobilize your lumbar spine, because you're also going to have some degenerative joint disease. There's no one that has degenerative disc disease and stenosis that doesn't have a little bit of arthropathy. That means arthritis in your lumbar spine. And without load on my spine, that means no gravity is pushing down on my spine right now. Gravity's coming this way instead of traditionally when I'm standing and walking, it's coming from my head down and compressing my spine. So I have some space there. I'm up in this position. My back is flatter, and I could do knee, rock side to side. I'm not going for max range of motion here, like I'm trying to establish gigantic end range changes in anybody. I'm really just getting the back to mobilize without load on it in a slightly flexed position to mitigate some of the pain that they have from their joints. It's just like pendulum or easy exercises for the shoulder, ramp pain down. This is like pendulums for the low back. Very easy, within a pain-free range of motion, not looking to get bigger flexibility, more or less just looking to kind of move joints that maybe have been locked up for quite a while. And I'll go back and forth as one, and I'll do 20 reps. Those are my 3 favorite low back exercises for spinal stenosis to help mitigate that pain, get the back stretched out, get people feeling better immediately. I give that for homework all the time. There are many, many other things that we want to talk about, for spinal stenosis, but that's a great start. Hope that helps.